Hi, hello. Welcome to another episode of Manta Care's Patient from Hell podcast. My name is Mike Lynn. I'm a patient advocate here at Manta, and I'll be your host today. Today's episode is funded by the Patient-Centered Outcomes Research Institute, or PCORI. The goal of this collaboration is to bring doctors or researchers onto the Patient from Hell podcast to share about their research so more of us can learn about it and use it to help us in our lives as patients or care partners. The Patient Podcast Club gives us the opportunity to chat with members of our community to get their perspectives on an episode. Maybe to put it more simply, this is where theory gets put into practice for cancer patients and their loved ones as we gain more knowledge about updated standards of care in the world of cancer. Today, my guest is Ashley Dedman, the Vice President of Mission Delivery and Living Beyond Breast Cancer. And Ashley, I'm excited to hear your story and your thoughts on the podcast episode. So let's start with your personal background before digging into the conversation that Samira and Dr. Bell had. Ashley.
Hi, Mike. Thank you so much. Hello, listeners. My name is Ashley Dedman. I am the Vice President of Mission Delivery at Living Beyond Breast Cancer. Living Beyond Breast Cancer is a national nonprofit organization. We seek to create a world that understands there is more than one way to have breast cancer. To fulfill our mission, we provide trusted information and a community of support to those impacted by the disease. Living Beyond Breast Cancer offers in-person experiences and on-demand emotional, practical, and evidence-based content. I will have to say, 30 years since our inception, the organization remains committed to creating a culture of acceptance. We're sharing the diversity of lived experiences of breast cancer, foster our self-advocacy and hope as a community.
That's a lot of good information in one little blurb. You know, I find that every time I talk with patient advocates or advocates in general, I'm amazed at the scope of what people are willing to do to kind of further the lives of cancer patients and their loved ones, because it's a tough space to be in, but it's really rewarding.
It is a tough space. And while I've never been diagnosed, I can definitely understand that as a caregiver. My mother had metastatic breast cancer and my father is a prostate cancer survivor. And so having conversations like these are so important, Mike. So thank you for having me. Thank you to Manta for having me as well.
Yeah, definitely. So today we're going to be reacting to the Podcast from Hell episode number 56, which features Samira Daswani, the founder of Manta, and Dr. Erica Bell. And as it pertains to the episode, I'm going to give a brief overview. So if you're watching today and you haven't seen it, you'll kind of understand. I mean, please go check it out. But otherwise, we're going to be talking about something called DCIS, or ductal carcinoma in situ. And then we're going to talk a little bit about our respective experiences as patients and or advocates. So DCIS, ductal carcinoma in situ. It's a non-invasive form of breast cancer. It's often staged or effectively staged at 0. And it develops in the milk ducts of the breast. It's often asymptomatic and is detected by mammograms or biopsy. It does account for a large portion of breast cancer diagnoses at this point in time. It's like 20 to 25% of breast cancer diagnoses in America are now DCIS. But the thing that has been changing in the science behind it, or the standard of care, is what you do about it. Because the typical standard of care, one of the main decisions or inflection points, is whether there would be a sentinel lymph node biopsy in addition to lumpectomies, mastectomies, or radiation. And I have not had breast cancer. I am a stage 4 metastatic melanoma patient. I've had some mammograms to check for things in my breast tissue, but it becomes a question of how a patient wants to accept risk or take risk or understand that there is a risk of recurrence with any and all breast cancer. And DCIS presents a kind of, do we want to go through with something that can create lymphedema, which is swelling in the armpit area after you move a sentinel lymph node? And one of the main things in this episode that I saw, actually, I do want to, I'm going to interrupt myself. I thought it was really kind of interesting that Samira, having been diagnosed with breast cancer during the pandemic, right as COVID was ramping in 2020, she was talking with Dr. Bell about BACC, and they have a direct connection there because Samira, the organization that Dr. Bell is with, helped her get through her initial diagnosis. It was a very cool, like intimate connection. So I thought that was like a really neat way to see how the cancer community, which it's so big in theory because cancer affects everyone worldwide, but in practice, you find these like little pockets of people that have affected your life without really even you knowing it. I'm sure Samira knew at that point. Um, do you want to talk about a little bit of your advocacy, Ashley? Because I know that's, what we're here for. We're here to help promote information and awareness for people who are affected by cancer. Let's talk about your role a little bit in that.
Thank you so much. So, to talk about my current role at Living Beyond Breast Cancer, I have to really start with my origin story. And my first form of advocacy came when I was a teenager. And as I shared earlier, my mother was diagnosed with metastatic breast cancer. We actually found out because we went into the emergency room because she had some back pain. And coming out of the emergency room visit, that's when we learned that she was stage 4 or metastatic. And at the time, as I shared, I was a teenager and our world was just flipped upside down. This was really the first time that breast cancer diagnosis had hit our address. There was family history of breast cancer going back to grandmothers and great grandmothers. But this was really the first time that like I said, it hit our home. And so my advocacy really began then. And that was not in a traditional sense. It was being a child and accompanying my parents to my mother's doctor's appointments, and being a part of the conversation and listening, and having them have conversations, ongoing bidirectional conversations with me, so that I was aware, and I was also knowledgeable. But also it was knowing that I would say years later that they were giving me bits and pieces of information that I needed for where we were at that point in time. And I really appreciate their approach because it really preserved my innocence and the time, I would say I guess you could say my innocence, but the time, that time I had with my mother. And it really helped me to keep my hope, if that makes sense. And so that's really where my advocacy started. And then shortly after my mother passed away, I realized the learnings and the experiences and the interactions that my parents had with me really positioned me to then be able to advocate for my father. And so I had gone to enough doctor's appointments that when it became time to be my father's caregiver, I already knew what to do. I knew what questions to ask. I knew what questions I needed to ask him. And so that's really where my advocacy began. And then from there, I always say I've been in a profession where I've helped people. I'm in a people profession. And so I, at the time, was a health and PE teacher where, again, I'm advocating for children and their health. And over the course of my career, every step that I've made in my career has been one of being able to advocate for other people. And that's really what brought me to the mission of Living Beyond Breast Cancer was my origin story. Being able to provide trusted information and a community of support is really connected with my personal mission as a person. And when I saw the great work that Living Beyond Breast Cancer was doing during my career transition process of finding a new organization, the mission really spoke to me. And ever since I've been at LBBC, I've been here almost a year, Mike. It just really has reaffirmed that I made the best decision and why I'm here. And I think the blessing is that I'm able to work with other team members that have a shared mission and a shared passion.
Yeah, I mean, You brought up so many points that resonate with me personally as well. You brought up not only the kind of preserving your innocence through a first encounter with cancer, but also kind of the accumulation of knowledge into, secondary experiences, both personally and as a caregiver. And so for me, I'm a stage 4 metastatic melanoma patient. I've had 3 diagnoses of it in the last 7 years. I'm doing treatment right now. It's all going fine. That's not really the point, but, initially, or not initially, 20 years ago, my dad was diagnosed with stage 0 or stage 1, skin cancer as well. I had a vague understanding of what went into it, but it was not particularly threatening. 20 years later, or maybe 15 years later, when I was diagnosed for the first time, obviously it was relatively shocking. I was 30 years old. I've been through all of the song and dance now. And what I learned is that each time you encounter cancer, you become more familiar with the games surrounding the diagnosis itself, because cancer is this huge, scary topic for most people. And if you haven't encountered it, it's almost like this, you don't know anything about it. You picture, the gaunt person on a respirator in a hospital bed, but that's not really what cancer is for everyone, and unfortunately it does get there for some people, but the majority of dealing with cancer is understanding how to deal with what a diagnosis leads to, how to get into treatment, how to caretake. And so the full circle element of it that you brought up is my dad was diagnosed with a recurrence 2 years ago as well. In fact, we were both diagnosed with cancer within a week of each other, which was probably not fun for my mom, but we're both doing okay. But it was weird to all of a sudden go from the role of, a child observing his parent 20 years ago to then saying, hey, I've dealt with this a lot. I work as an advocate now. I got this. And it kind of helped, unify us as a family in a strange way, because we were all familiar with the world of cancer by then. Excuse me. And it shows how powerful, information is in caregiving, which it was a main point that was brought up in the episode of the Patient from Hell podcast, is that it's a really complex thing to make decisions as a cancer patient, and especially as a caregiver, because there are standards of care that have existed for years and years and years in cancer, just depending on what type of cancer it is, how well developed the treatment is, etc. But it's always progressing, or it seems like it's always progressing now that I'm in the space, which is another thing that people don't know about cancer treatment and cancer in general. It's like the progress that we're making in the science is amazing, but it really, people still have this picture of, the more barbaric chemotherapies and, the radical mastectomies and all the things that happen to affect breast cancer patients, for example. And DCIS, as they've found, the goal now is not to do these sentinel lymph node biopsies, because it creates a lot of damage in most of these cases, but it's still, it's on the table theoretically. And I know there are people that I've spoken to who have had this happen from a DCIS diagnosis. And so I think, what you were talking to about how you're spending your year in mission delivery and how it's been, so fulfilling for you, is that getting information at the right time is kind of the name of the game, because the information for most of the stuff in cancer land is there. But when you're a patient, it's this crazy emotional whirlwind, and it's less about what exists, and it's more about like, how do you find what exists within the right time? Because when you're diagnosed, it's not like, oh, I can sit around and wait to figure out how to do all this. You have to make decisions because you're fearful for your life, and rightfully so. In your work, how do you see that play out?
Great question, Mike. You touched on a lot of salient points, and I want to acknowledge and thank you for sharing and being open with your experience and the experience of your family members. And you're right, we are all going to be impacted by this disease at some point in our lives in different ways. And when you look at patient advocacy, it's with the patient and with their caregiver working together. Sometimes that advocacy looks different, where the patient is able to advocate more. And then there's times where that caregiver may need to step in and step up to advocate. And it looks different for every person, every family, and every community. And to your point around talking about DCIS and the sentinel lymph node biopsies, it's important because, like you said, the science and the technology is advancing, and we're so grateful for the advancements. I think back to when my mother was diagnosed in 2007, and here we are in 2025. And it's amazing to see the progress that has been made. And I know there's still progress that needs to be made. And I know that that we will get there. And so really bringing it back to DCIS and the sentinel lymph node biopsy, I think it really underscores advocacy and being aware of the diagnosis of DCIS, what that looks like, what treatment options are available to persons who are diagnosed, and being able to understand that particular diagnosis. We know that every breast cancer is different. And we know that access to care is different for every person. And we know that that access to information is different for every person. And at Living Beyond Breast Cancer, our goal is to really to empower our community to continue to share the trusted information that we provide, so that when a person and or their loved one is diagnosed, that Living Beyond Breast Cancer is there to be able to provide that trusted information. Under the teams that fall under my leadership is the educational programs team. And our team provides trusted information through, as I shared, in-person experiences through our metastatic breast cancer conference, as well as year-round educational programming that touches on topics like the ones we're discussing today. And that, Mike, is so that people have the information when they need it. They can go to our website and access it retrospectively, and so being able to have that, I believe, can help to provide a roadmap for people as they are beginning their experience. We have really heard from our community that some people have wished they had found Living Beyond Breast Cancer earlier and found our trusted information earlier, because they would have made some different decisions. They would have had more knowledge going into the conversations with their care team. And so as we have these conversations today, I think it's really important when we talk about DCIS, the diagnosis and the treatment options. It's really important that that persons understand the advancements, and those have been to be able to provide more tailored approaches to treating DCIS, to decisions on how decisions on how factors like size, grade, hormone receptor status of DCIS, as well as the patient's age, overall health, and other preferences all play a part in the patient's decision making. So yeah, hopefully that answered your question.
And like the thing you said that struck a chord with me most, as we're kind of wrapping up here, you talked about the lens that every different patient will come in with, or caretaker. It's always different. And, we use the term peer a lot in the cancer space, whether it's for advocates or caretakers or patients, but everyone's life is an individual life. Everyone's diagnosis is individualized, and our experience is never going to be someone else's, or rarely going to be someone else's. And being able to think about it from the lens of someone who's new to the space is so important, especially as you brought up that information flow is so critical. And, for organizations like Living Beyond Breast Cancer or Manta Cares, I mean, this is why we're putting in the work, so that people have not only the best information, but the best suite of options to do something with that information. Because when it comes down to it, that's what you need to have. You need to have the availability of all these things so that you don't feel regret. I've had a lot of good care in my experience, but there are times where I've thought, okay, if I had known what I had known years ago, I would have done that. And, I don't want to keep getting cancer to test it out, but now that I work in the advocacy space, I can hopefully impart that, onto other people and help them in their journey with all this.
Absolutely. And, patients should be fully informed about their diagnosis, their treatment option, potential risk and benefits. And when I look at the information that we provide as an organization, that's our goal to help guide and inform. And when I think about MantaCares and the support you all provide to help navigate that pathway, to be able to help persons who've been diagnosed and their caregiver understand the questions they need to ask, the information they need to capture. It goes hand in hand. And so when we talk about patient advocacy, it truly plays a crucial role in the decision-making process, in the information gathering process. And it's not a one-time thing, it's ongoing because as we said earlier, as the science and the technology advances, sometime year to year, you have to have those conversations again. You have to gather that information again. And I believe that's what we do. We provide trusted information, timely information, updated, incredible information, so that persons who've been diagnosed and their caregivers have what they need. And when we talk about DCIS and the sentinel lymph node biopsy, it's important that you have all of the information as it pertains to your diagnosis, all of the options, and then having these bidirectional and ongoing conversations with your care team as to why something may or may not need to be done, and being able to share that with the person who's been diagnosed, with their caregiver, so that they're able to make an informed health decision.
Absolutely. And I mean, ultimately, that's why we're sitting here talking about it too, because the more voices you have surrounding, these inflection points in the information, the better off future patients are going to be. And that's always the goal.
Absolutely. And I just want to add one other thing. A diagnosis of DCIS can be emotionally challenging. I think anyone who's diagnosed, no matter the stage, hearing the words "you have cancer" can be emotionally challenging. And it's really important that psychosocial support is a part of that process. When having to make decisions and having to process that information, I want to acknowledge the mental impact, the emotional impact that can have on a person who's been diagnosed and their caregiver. And so being able to access psychosocial support that we provide here at Living Beyond Breast Cancer. And as I shared earlier, with MantaCares and the journals and the online pathway, that really, I believe, when I was first introduced to MantaCare, I got really emotional because I remembered that we didn't have that resource when my mother was diagnosed. It was overwhelming. How do we track this? How do we write this down? How do we know what's next? What steps are next? And so when I was introduced to MantaCares, I was touched because this is a need that's being met. There was a gap. And MantaCare has closed that gap and is meeting that need by providing the pathway and the questions and the next steps that people need to know about, because they haven't had to know about it because this is new.
Yeah, absolutely. I mean, the reason I got into patient advocacy was mostly for mental health purposes. I mean, my mental health completely deteriorated after my first diagnosis, during my first diagnosis. And, I was in remission for 4 years in between it. And I had the opportunity to at least consider, like, okay, if I have gotten through this, then it probably will just be something I put in the rearview mirror. But as soon as I had a second diagnosis, I, not only for my own good, I said, I need to start talking about this. I need to start letting people know that there's more to it than just the treatment element of it or the structural element of the diagnosis itself, because one of the only things we can control is the mental health aspect of it. I mean, how your body responds to treatment is how your body responds to treatment. But for Living Beyond Breast Cancer or Mission Delivery or MantaCares, a big part of the organizational goal is to let people know that they're not alone and that they can be helped in ways that aren't just clinical. So yeah, I think you brought up a great point there. I think we're going to wrap up on that note. But Ashley, I really want to thank you for joining us today. I want to thank Dr. Bell and Samira for giving us some background to talk about. And where can we find stuff that you're working on? What is Mission Delivery and or Living Beyond Breast Cancer? Where can we find those things?
Absolutely. So I encourage everyone to head to our website, livingbeyondbreastcancer.org. Here on our website, you can find that trusted information around psychosocial support, information around sexual health, information around caregivership, support services for everyone in the family, ranging from caregivers to children. We also offer support services through our LBBC fund, as I shared earlier, through our educational programming, as well as our amazing blogs and content from persons with lived experience that are sharing their personal experiences with others. And so it's lbbc.org. And I'm so thankful, Mike, for this conversation.
Yeah, Ashley, thanks again. And that'll do it for us today. So thank you for listening and have a great day.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of MantaCares Inc. or MantaCares' sponsors. This episode was supported by an award from the Patient-Centered Outcomes Research Institute.